Hello everybody and welcome to PCR London Valves 2025. My name is Chris Allen and I'm delighted to be joined here in the studio by course directors Francesco Maisano and Nicolo Piazza. It's been another bumper year for the tricuspid aspect of the program today, and we're here to talk about the highlights. So Francesco, the tricuspid focus group continues to go from strength to strength and grow its activity. Could you tell us about what areas we were highlighting today?
I think, first of all, focus group is active since 2021, and in only 4 years there has been a huge amount of work that has been contributing to what we stand today. And focus group has been actively participating in the program production. So lots of the program that we have been seeing these days have been produced basically by the participants. And somehow the guidelines reflect also most of the work that we have done collecting data as a community and establishing a network to facilitate the introduction of new procedures into clinical practice. And we're very delighted to see that now we are in this stage of the evolution of tricuspid interventions.
Amazing. It's great to see all the hard work coming to fruition. And Nico, we know that imaging is critical to the diagnosis and treatment of tricuspid regurgitation. There have been some exciting developments there this year.
Yeah, well, look, as you mentioned, imaging is one of the challenges that the physician faces during the diagnostic and also during the interventional phase of the patient management. So, this year at London Valves, we really wanted to focus on imaging of the tricuspid valve. So we had the imaging learning lab where participants were able to learn about multimodality imaging using echo, fluoroscopy, CT, and even intracardiac echo. There was both didactic and hands-on experiences in the skills lab as well. And I believe, Francesco, there was also something in the simulation lab, right?
Absolutely. Well, there is a growing number of operators. There is a growing demand for operators. And I think simulation is the best way to start your practice, understand features which are otherwise difficult to clarify without the use of a simulator, where we actually simulate mistakes. Yeah. You can't do it in a human being. Yeah. We focus on details which are very nicely seen on an anatomical specimen or within a specific simulator where you have cameras watching the device as it interacts with the anatomy. So we had, as usual, a very large program on simulation-based learning, followed by hands-on training and by training village opportunities, more than 150 offerings from the industry, so that the physicians could run from a generalistic approach into a device-specific kind of hands-on training and exchange of information. I think that is the essence of London Valves. It is a platform for doers who want to do, who want to exercise, who want to share their own experience, their own opinion. And I think there is no better way than having tools to play around and to exchange ideas.
Wonderful, and a really high quality, high fidelity practical experience for everybody at all levels and all stages of experience. And that was certainly in evidence with the live cases, Nico.
Yeah, I'm just thinking, it's see, sim, and do. See, sim, do. Yeah. We go to the imaging learning lab, we go to the simulation lab, we see, yeah. We do. And then we go to the live cases, and then we can actually see all of this take place live. Yeah. And so this year, given the growing number of tricuspid interventions, there were both repair and replacement procedures. And so the participants got an opportunity to see all the different procedural steps and the application of perhaps what they learned during their experiences here at London Valves to be applied to the live cases.
Brilliant. And Francesco, away from the cases aspect, there was also some important data presented.
As you know, PCR London Valves is a practical meeting. We are probably not always having a lot of data, but there has been late-breaking trials in all aspects of structural interventions. And in terms of tricuspid specifically, there have been some data coming, which is very important, about new devices that are very close to be approved in clinical practice. So again, it is a huge opportunity for the community to be informed early enough to be ready for new devices to come, new opportunities, and a broader option for our patients, and to be able to treat more and more patients in a more specific and tailored approach as compared to the past.
Fabulous. Well, gentlemen, thank you very much for joining us. There you have it, just some of the selection of highlights from a packed program from the tricuspid side of things, with lots of exciting aspects to come in the future. Thank you for joining us.